Join me as I dive deep into the world of gestational diabetes tests to figure out what they're really testing for. Gestational diabetes tests, you've probably heard of them, especially if you're pregnant or planning to be. But have you ever stopped to think about what these tests are really measuring? Today, we're going to explore the ins and outs of gestational diabetes tests and why they matter. As a pregnant woman, you're likely no stranger to the plethora of tests and screenings that come with pregnancy. But gestational diabetes tests are a crucial part of that process, and for good reason. Gestational diabetes affects up to 10% of pregnant women, and if left undiagnosed, it can have serious consequences for both mom and baby. So, what's the point of these tests, anyway? Simply put, they're designed to detect gestational diabetes, a type of diabetes that develops during pregnancy. But why is it so important to screen for this condition, and what are these tests really looking for? The short answer is that gestational diabetes tests are looking for abnormally high blood sugar levels. But why is that such a big deal, and how do these tests actually work? We'll get into all that and more in just a minute. Screening for gestational diabetes is a routine part of prenatal care, and it's usually done between 24 and 28 weeks of pregnancy. But why is it so important to screen during this time? For one, gestational diabetes often doesn't cause any noticeable symptoms, so many women may not even realize they have it unless they're tested. The good news is that gestational diabetes can be easily detected and managed with the right care. But it's crucial to catch it early, which is where these tests come in. By screening for gestational diabetes, healthcare providers can identify women who are at risk and provide them with the necessary care to prevent complications. So, how do these tests actually work? It all comes down to glucose levels. Glucose is a type of sugar that's naturally present in the blood, and it's an important source of energy for the body. But when you eat, your body breaks down the carbohydrates in your food into glucose, which then gets absorbed into the bloodstream. The glucose challenge test is a common screening test used to detect gestational diabetes. It involves drinking a sugary drink and then getting your blood sugar levels checked an hour later. The idea is that if your body is able to regulate blood sugar levels normally, your glucose levels will return to normal within an hour. But if you have gestational diabetes, your glucose levels will remain high. There's also the oral glucose tolerance test, which is a more in-depth test that involves fasting and then getting your blood sugar levels checked at various intervals after consuming a sugary drink. This test provides a more detailed picture of how your body is handling glucose, and it's often used to confirm a diagnosis of gestational diabetes. So, what are the different types of gestational diabetes tests, and how do they differ from each other? Let's dive in. The glucose challenge test is usually the first step in screening for gestational diabetes. It's a quick and easy test that involves drinking a sugary drink and then getting your blood sugar levels checked an hour later. The oral glucose tolerance test, on the other hand, is a more in-depth test that involves fasting and then getting your blood sugar levels checked at various intervals after consuming a sugary drink. This test provides a more detailed picture of how your body is handling glucose, and it's often used to confirm a diagnosis of gestational diabetes. There are also other types of tests, such as the hemoglobin A1C test, which measures your average blood sugar levels over the past few months. This test can be used to diagnose gestational diabetes, but it's not as commonly used as the glucose challenge test and the oral glucose tolerance test. So, what are the risk factors for gestational diabetes, and how do they influence the testing process? Women who are overweight or obese, have a family history of diabetes, or have had gestational diabetes in a previous pregnancy are all at higher risk for developing the condition. Additionally, women who are older than 35, have polycystic ovary syndrome, or have a history of heart disease or high blood pressure are also at increased risk. If you fall into any of these categories, your healthcare provider may recommend earlier or more frequent screening for gestational diabetes. So, What are the symptoms of gestational diabetes, and why is early detection so important? The truth is that gestational diabetes often doesn't cause any noticeable symptoms, which is why screening is so crucial. But if left undiagnosed, gestational diabetes can cause serious complications, including high blood pressure, preeclampsia, and even premature birth. Early detection is key to preventing these complications and ensuring a healthy pregnancy. And the good news is that gestational diabetes can be easily managed with the right care. With a healthy diet, regular exercise, and in some cases, medication or insulin therapy, women with gestational diabetes can have a healthy pregnancy and birth. So, what happens if you test positive for gestational diabetes? Don't panic, it's not the end of the world. With the right care and management, you can still have a healthy pregnancy and birth. You may need to make some lifestyle changes, such as following a healthy diet and getting regular exercise, and you may need to take medication or insulin therapy to regulate your blood sugar levels. In some cases, you may need to have more frequent prenatal checkups or ultrasounds to monitor your baby's growth and development. But with the right care, you can still have a healthy and happy pregnancy. So, what are the long-term effects of gestational diabetes on both mom and baby? For mom, gestational diabetes can increase the risk of developing type 2 diabetes later in life. In fact, up to 60% of women who have had gestational diabetes will go on to develop type 2 diabetes. For baby, gestational diabetes can increase the risk of birth defects and developmental delays. It can also increase the risk of macrosomia, or a larger than average birth weight, which can make delivery more difficult. But the good news is that with proper management and care, these risks can be minimized. So, what's the takeaway from all this? Gestational diabetes tests are an essential part of prenatal care, and they're crucial for detecting and managing this condition. By understanding what these tests are really measuring and why they matter, you can take control of your health and ensure a healthy pregnancy and birth. Thanks for joining me on this journey into the world of gestational diabetes tests. If you've had any experiences with gestational diabetes tests or have any questions, leave them in the comments below. And don't forget to check out our related video on gestational diabetes diagnosis and management for more information. Until next time, stay informed and stay healthy.